This episode is sponsored by ODP Business Solutions, built to address all your facility needs. Visit odpbusiness.com today. It is my pleasure to welcome back the president of ISSA and the CEO of Servicon, Laurie Sewell. I hope you're doing well.
Oh, I am. Thank you for having me today.
Absolutely. It's great to have you on. I know we're going to talk about how cleaning for health is for everyone. It's a topic close to your heart. You've emphasized that cleaning has always been about health, not just appearance. What do you think is still holding the industry back from fully embracing that concept?
I don't know if it's the industry holding ourselves back, um, or the clients we support. I think that it requires education of our employees and ourselves first, as well as education of our client. And we have to get over that hurdle of clients saying, I want low cost, low cost, low cost, right? And so if they're not viewing it as cleaning for health, then they're just viewing it as some kind of budget line that they don't want to see go up, and they're not tying that connection between the work that we do and the health of the people that are in those facilities, the health or the good work or the improvement of the work. And so I think it's continuing to fight, that good fight of educating and explaining, and making everyone in your organization an advocate for that, which includes your workforce, and really letting them understand their role. Not just we go in and we do this work, go in and dump the trash, vacuum, do this. We're actually teaching and training them. The reason we're doing this and the reason you're using this product is because it's taking the dirt out of the environments. It's improving the indoor air quality. It's, so we're giving them the why of their work, not just the how. So I think it starts there, so that then they are advocates at the frontline level. And then it's continuing to bring this up in conversations with our customers. It's not, allowing the conversation to become just about financials, really elevating the value of the work. And that's hard when you're in a competitive situation and you're fighting for every dime. It's difficult, I think, to do that.
Those pesky clients, what are you going to do?
Yeah.
You also mentioned something about even non-critical environments like classrooms, retail stores, warehouses deserve health-centered cleaning. Now, you kind of were going that way, but in those environments, how can professionals begin to implement and advocate for the standards cleaning for health there?
The other thing that I spoke about or alluded to was documenting, right? Being able to prove what clean is versus the visibility of clean, right? So when you're actually using some measurements to identify how indoor air quality is impacted, post and prior your work, there's a lot of affordable measurement techniques out there that you can do. ATP is one of the older ones, but still holds up in terms of showing pre and post cleaning and what it does for the environment. And then you have to draw that line. You have to show that through line between what I've measured and how I've proven to you that it is healthier, not just looks better, but is healthier. And then what is that impact on the population in that facility? So when I talked about critical environments, super easy when you're in a clean room and you're not allowed to operate in that clean room, or do certain types of activities unless your particulate matter is at a certain count, right? That's just more of a functional. Can I do this work in that environment or not, right? Well, we don't have those levels in what we might consider non-critical environments. But frankly, if you're in a school and indoor air quality, impacts the breathing, and asthma is way up in childhood. Asthma is up considerably. We know that if kids are having issues, they're not going to learn. They're not going to be able to get the full value of what they're supposed to get in that place, because they don't have a healthy environment. That's a really good example of that. And then, workers in warehouses or whatnot, if they're, expecting to be productive, why wouldn't you want to have a healthier environment for them, better air quality, fewer pathogens? Not just because they aren't at risk as, their health isn't, maybe they're not, have poor health, but it will increase productivity. As well as, just, general well-being and people not being out from being sick. I mean, it's just the problem is that through line isn't as easy to see. It has to go through a couple other places for them to see the end result.
You mentioned clean rooms, there's healthcare settings, there's operating rooms. And I believe at Servicon, you folks handle those scenarios.
We do, absolutely. We work in EVS, we work in GMP labs and in labs where ESD is an issue. So much easier to show that through line
Mhm.
because primarily because there are third party agencies and organizations that are requiring that. Could be the
Yeah.
client, right? It could be JCO or some other agency. So when you have a third party weighing in, that's usually a lot easier to make that connection.
So thinking about that, what lessons from those settings can we then apply to the more everyday environments to raise the bar across the board? Can you think of anything there?
It's a great question because I literally just thought of the concept of it, what is similar there, and it's that third party, right? That regulatory piece. And so, some of the things I did talk about is we have to work with our policymakers too, for them to understand and appreciate, what a clean environment is or a healthy environment is for, say our students or our public facilities where we're bringing the public in, what type of requirements or measurements should we be holding ourselves, first as an industry accountable to? But it's a good question for us all to think about and explore, I think.
Yeah, so as you're in those scenarios, in those environments, what can we take from this to apply here? It's an ongoing issue, I'm sure. But
Mhm.
Laurie, your call for change and the metrics we use to define clean, let's talk about that. What kinds of data, technologies, indicators do you think that we need to embrace more or that are available that we need to really look at to make cleaning for health more of a reality?
So I think sensor technology is one that's really coming to light. I mean, obviously there's financial considerations around, how scalable that technology is, but sensors can smell, they can hear, they can sense dust, they can detect pathogens. I mean, there's just amazing things that we can do with sensor technology today. I think the key is where's the best place to put them to learn what information, and then how do we take that data and how do we integrate AI to actually make our work more. This is where if we do this right and we can figure out this formula that we can then be able to be more efficient with how we deliver our services to achieve that optimal health situation at something that isn't a higher cost to the client, right? So if we can find a way to do it in a way that saves money or is cost neutral, I think that's when we're going to find that perfect nexus. So there's still the traditional ATP, indoor air quality. I know indoor air quality is a huge aspect of cleaning, and I know there's a lot of IAQ companies working like either side by side with our industry or starting to work with our industry. I think there's a huge opportunity to work closely with infection prevention people for different types of measurements, and two, indoor air quality people. And how are we partnering with them as an industry to find better ways of measuring what clean is effectively?
So from your comments, we have the tools. We just need to use more of them or figure out a better way to take them and tell our story.
Right. And to make it scalable, right?
Hmm.
Because I think some of it is more piloting proof points rather than putting something, it seems crazy to try to put everything in all over the place. But I actually have a funny story that relates to this. My daughter had a science project when she was in grade school, and being in the industry that I'm in, what her project was, and I helped her with, was we swabbed um, door handles of each of the schools. So we swabbed the cafeteria, the bathroom handles, the handles of the kindergarten, the handles of the teacher's lounge, and then we put them in petri dishes to see, what kind of result we got, and which had more bacteria. And that was a very basic example of showing measuring health, right? Measuring the health of it. And it was interesting because the teacher's lounge was one of the worst because they were going in and out, in and out. Obviously, cafeteria was really bad. But the kindergarten restroom, had their own restroom, was very low. And everybody thought, oh, we thought kindergarten kids, this, that, it would be a lot higher. Well, the funny thing is when my daughter was in that kindergarten class, I gave them a dispenser with hand sanitizer, and the teacher taught the kids how to use it and how to wash their hands properly after the restroom. And that showed a big difference. I was like, wow, there's an incredible proof point right there on, the health and how you can change the health of that environment. Particularly, when you call a petri dish, I think kindergarten is a petri dish all its own, right? But that's a fantastic example of using a very low technology way of validating if something's clean or not. So funny, I
And
hadn't thought about that in a while because she's 23.
in a while. It would not shock me, Laurie. An article you send to me for ISSA Today magazine will be lessons from kindergartners. It would not shock me.
Thank you. All right. I'll have to dig up her hypothesis and her conclusion there.
The enthusiasm of youth, the kids, they
Yeah.
they were given a tool, they were shown how to
Mhm.
use it, and they
Mhm.
embraced it.
Yeah.
That innocence but effective attitude. There are lessons to be learned from
Mhm.
young people, small
Yeah.
people.
Yeah. And they were very excited when we were doing the testing and everything to understand what it meant, that they couldn't see it, but that it was harmful. So there's, again, goes back to that education piece, right?
Mhm. And all you school teachers out there, yeah, clean your rooms.
And
What you
sanitizers.
said was the break room was the worst.
Teacher's break room and
Yeah.
the kids, the cafeteria.
Well, yeah, that makes sense. All
Everybody's
right,
going in there.
Lori, let's end with this thought. As president of ISSA, all this information, these goals in your head that you want to see happen, how are you encouraging the entire industry to carry this message forward, both within companies that do the work or facilities that do the work, and to clients and policymakers as well?
Yeah. Yeah. It's just starting with the conversations with your clients, with your teams, educate them about the difference. Take a technology out there and show them, take a swab in a petri dish and take the petri dish a week later, take ATP, take an air quality meter. I mean, these aren't very expensive tools. Show them what the difference is before and after. We did a lot of that in COVID, right? When we did COVID cleanings, we did pre and post. And then we presented a chart and a graph to the mesmerizing. The clients were just incredibly impressed, and obviously that was more of a life or death situation in their minds versus healthy or not. But it's really drawing that through line that I talked about. So invest in some of these training, some of the tools and technology that allow you to measure outcomes, not just visible outputs. Speak the language of value. Show how what we do reduces absenteeism, improves productivity, protects lives. I know ISSA has a number of white papers that they've done in the past. There are, with large language models and deep research, you can go out and find a lot of these studies. Some of them have been done internationally that can support what you're talking about. Show them that we are a professional industry, that we are, doing studies and research, and how does that impact them. And then advocating for standards that define clean beyond the visible, either at a policy level, or just maybe by sector. The commercial real estate, or the education is a great example. How are we defining clean in education versus how often we do something. And then continue to elevate the status of our cleaning professionals. It's really not about marketing. It's really about the mission that we all are involved in.
Well said. I like that. It's about the mission, not the marketing. Yeah. And that's often the focus, the marketing, the dollar, the
Yeah.
clients you can get. So, Lori, thank you for this great conversation. And
Yeah.
I look forward to hearing more about the kindergartners. And
Great. Thank you, Jeff. Take care. Bye-bye.